Hi, I'm Siobhán Fletcher and welcome to the latest edition of our newscast. Can you, I suppose, first of all, confirm the position on health cuts, which ones are or aren't happening?
Okay, so I think it's just important to say that at the beginning of January, the Manx Care board agreed an additional set of measures which would help its financial position for the remainder of the financial year. We are currently recording a deficit of 14.7 million and are required to maintain no more than a £15 million overspend for the rest of this financial year. So we agreed a set of measures in January and have subsequently undertaken the planning for implementation of those measures, which would take effect from the 1st of February. There has been discussions in parallel with the Department of Health and Social Care, just in terms of making sure they understand the measures that we're taking and are supportive of those measures. And as a result of the discussions over the last couple of days particularly, a decision was made this morning by Treasury to support us spending in order to not have to do all of the measures that we outlined, which were originally planned and part of what the Manx Care Board agreed. So in terms of what is still happening, we still want to make sure that our off-island providers are only treating those patients that require urgent cancer and time-critical procedures. And we are asking those clinicians to clinically validate. If people do need their surgery, and that is supported by clinicians, then they will continue. But we have given a what I would call a clear and firm request to those providers. The tertiary budget that we have, we spend around £32 million with those providers, and it is really important that we are able to take the appropriate steps to make sure that expenditure is controlled. So this was what I consider and what we thought to be entirely reasonable, just by pausing a number of those patients who would be classified as routine over the next 8 weeks. Now, we do know that there has been some confusion, so we are working really closely with those tertiary providers to make sure the wrong patients are not getting cancelled, and we are doing that appropriately. And that is still going ahead. We want the opportunity for those tertiary providers to work with us. We want to look at where we can do virtual outpatient appointments for our patients to perhaps have their diagnostic tests here on the island, and to repatriate some of that work in order to control our costs. It costs an awful lot of money to send people off island, and we also know from a patient experience perspective, people would rather have their care closer to home if they can. So we do recognise this has been a little bit disruptive. But we are keen to make sure this is worked through with those tertiary partners. So if any members of the public feel their appointment has been cancelled and it shouldn't have been, then clearly please let us know, and we will work with those tertiary partners to make sure it's clinically validated, and if it needs reinstating, we will do that. But that is a significant amount of money. There's about £2.5 to £3 million worth of expenditure per month on our tertiary provision. In terms of the actions that we were going to take on island, we were going to also reduce routine surgery here on the island for those 2 months, and was also going to reduce some outpatient activity to allow our clinicians to do other work. Now, in light of the decision by Treasury today, we will be in a position to reinstate some of that work. Now, we've obviously spent the last 4 weeks planning to implement that from next Monday, so we will need a few days to get that back up and running. But that's the priority today and tomorrow, to reinstate those outpatients where we can. and also to relist for operations, again, where we can. There will still continue to be some disruption, and we still need to work on our costs and controlling those. So I'm not going to say there won't be any disruption around outpatients or planned elective procedures over the next 8 weeks, but we are attempting to mitigate all of that and reinstate as much of that as possible. Now, as ever, urgent, time critical and cancer surgery was not affected by these changes. We're obviously, the original plans meant we may well have been able to temporarily reduce our beds in Nobles Hospital, but in light of the surgery decision, that probably isn't going to be likely now. So the other measures that were in that original statement are still proceeding. So we're still doing all of those controls around expenditure, non-frontline decisions that are very much around exerting the maximum level of financial control in the organisation that we possibly can. And also, now we have resolved the pay dispute with our doctors, doing that intense period of job planning, which allows us to really understand what our costs are going to be and what our service delivery plans look like from April. I think it's really, really important. I know there has been some suggestions that the settlement with the BMA is connected to these savings. They're absolutely not. So this has been, the savings have been part of an ongoing commitment from Manx Care to reduce its costs. We started the financial year needing to make £19 million worth of cash out savings in order to achieve a balanced position. And it's been heavily reported that, we've not managed to do that. We will, by the end of this financial year, though, have achieved £15 million worth of cash out savings, which I think is a good achievement, which has largely not had any impact on frontline services. So we had to do some additional measures in September, as you know, so we did some elective cooling. And what we know is that those reductions did not increase our waiting lists. So we're able to mitigate those reductions of 5 theatre sessions per week. Now, obviously, given our financial position, this was an additional set of measures on top of those, which are difficult decisions for the board to make. We absolutely understand that this will be a highly anxious time for the public. And I'm sorry we haven't been able to provide more details sooner about what this looks like. I mean, clearly we've had to have a lot of discussions in the background in order to ensure that we have got the messaging and the appropriate approvals for this. But whilst also, these things don't just happen overnight, so we've had to undertake the planning and enact some of that.
Just to jump in there, a big criticism of this entire situation is this communication void. Where's the communication been? So Manx Care made the decision, as I say, at the start of January, but it is important that we get wider support and agreement, and there is a shared understanding across both Manx Care and DHSC and government as to what are the implications of these decisions. So in essence, it's taken longer than what we would have hoped to work that through and ultimately get full agreement and sign off on those plans. Something we've been dealing with today is this embargoed release. So we were sent that release on the 15th with a plans for a briefing and to be able to release those details on the 16th. Why was that media release pulled?
So we hadn't, at that point, got all of the necessary approvals and sign-off outside of Manx Care.
So why was it sent to the press then?
Because we had done our element of planning. We were ready to go, the Manx Care board. And like I say, in order to be able to implement this from the 1st of February, we needed to act quite quickly, and ideally we would have wanted to have informed everybody of these plans at that point. But as you can imagine, these aren't easy decisions for anybody. They're not easy decisions for Manx Care. And ultimately, decisions of this magnitude need to go through other layers of approval and support in order to allow us to work really collaboratively with both the department and with government. So, it has taken longer than I think that we would all like. And I think in the meantime, because the planning has still had to continue as though we were starting next week, there has been a crossover. And I think that has meant the public hasn't had the information it has needed in a timely way in order for us to make the appropriate reassurances when we can, but also the impact of any people who unfortunately are having to be rescheduled because of these changes.
But again, you talk about planning there. Why was the press release sent out with details to the media if that planning wasn't solidified and in place?
So our planning was complete at that point. So we sort of knew what we were needing to do from that point. But
so I suppose where does the buck stop then with these decisions? Because as you can see in that media release and in conversations, I mean, the cuts that the board put forward are then signed off by the board. Can they then be actioned by the board, or are you awaiting approval from the Council of Ministers, for example?
So in theory, Manx Care could just have proceeded with those changes and implemented those plans. We are a statutory board. The board was satisfied that those actions were appropriate given our financial position. You will know there's huge financial scrutiny of Manx Care and a huge pressure for us to reduce our level of overspend as much as possible. So, those two things meant the board felt these actions were appropriate, that we had considered the safety. We knew there would be a small impact on waiting times, but equally other really important work needed to happen. So those conversations with tertiary providers. So, all of those decisions were within the gift of Manx Care to make and the Manx Care board. However, I think this is where that collaborative working with the department and with wider government and making sure everyone is fully briefed and understand what we're doing and why we're doing it was really, really important. So, I think it's when you're making changes of this magnitude, it is really important that your key stakeholders, and by that I mean the department and government, understand what we're doing, why we're doing it, and they can play their part in reassuring the public and also supporting us to implement some of those changes.
So at the root of this then, is Manx Care arm's length or not? Because if you want me to give you an example, from another topic that's been massive in the news recently, the steam packet's an arm's length, organisation, different, I'm sure, but they make a decision about how many adults with kids on a boat, and, the government say, well, the department didn't have any say in this, they've just made that decision, it's commercial. If Manx Care is an arm's length board, an arm's length body, why is it not acting as an arm's length body?
I think it's a good question. It's a good question. We are arm's length. It is really important that the board is able to make the appropriate decisions, taking into account quality, safety, our financial responsibilities. But equally, we are a small island, and our staff, our patients are all constituents, and this is where ultimately Manx Care would want to make sure that the decisions it makes do take account of stakeholder views, political views, and we all work together for the best interests of the island's populations. These were very difficult decisions, very late in the year. We recognise they were impactful, and yes, quite rightly, it's important we considered those with our political colleagues, but equally, Manx Care is being held to account for its budget, and therein lies the tension of how we balance
increased demand on health and care services, increased costs of health and care services within a fixed budget. The discussions around the budget, Manx Care understands the impact of health and care overspending on the wider economic position of the island. And we take that seriously as a board. But then we've also got to balance that ongoing high demand and needing to modernise and transform and improve our health and care services. We really want to, a lot of these changes that we want to make are really trying to make us get to a sustainable position where our costs can be controlled. Hence the discussions with the North West and why we're still choosing to take that action even though we are reinstating some work locally. It is really important we have the opportunity to get better control of what our off-island costs are and use this as an opportunity to bring some of that work back to the island and really question those providers of whether some of that work is really necessary or not.
I guess there's a two-part question there with regards to the relationship between Manx Care and the department or the government as a whole. One, the health minister gets up in Tynwald last week and says, we're not aware of any cuts. Do you agree that she was not aware of any cuts, or was she briefed on the cuts?
I think the plans weren't finalised.
So she knew of some cuts though?
We always share the plans. The ability for those plans to be agreed and signed off was yet to be absolutely nailed. So I think it's not quite as black and white as it's not quite as black and white as Manx Care proceeding without any involvement. And again, it is about doing that joint planning and that joint sign-off and being able to, I guess, exercise that opportunity to, outside of Manx Care, create some solutions. So perhaps if I go back to the resolution on the doctor's pay, which isn't linked to these actions.
I do want to speak to you about that. I'm so sorry to jump in, but one other thing, because I asked the former health minister this yesterday, and just while we're on this topic, back in October when we last discussed cuts, when Manx Care had to bring this financial overspend under control, the now health minister said that Manx Care was holding a gun to the head of government, and I remember speaking to you about that at the time. I asked Laurie Hooper yesterday if he believes if government is holding a gun to the head of Manx Care, what would your position on that be?
I think the government is asking Manx Care to deliver as much as it can, but also we have been given a clear level of budget from which to work. My responsibilities and that of my team are to describe to the government what that level of funding buys, where we need to modernise, where we need to be more efficient, but ultimately what we can't have is a continuation, and this is where the Chief Minister's really helpful intervention in October around the alignment. So the mandate that is given to Manx Care and what it's been asked to do must align with the budget it has available. And then there is no issue around overspending or a lack of clarity as to what that looks like in terms of health and care delivery.
In terms of the mandate, though, I mean, we're talking here about cuts, you're talking about tertiary contracts and things like that. We're seeing certain services cut on the Isle of Man, like, for example, there's maternity, antenatal, prenatal, like classes and things like that aren't being offered by Manx Care anymore. Is that a rolling back of that mandate? Is that Manx Care saying that's not our problem anymore?
No, it's not a rollback on the mandate. I think it is making decisions about what are the most important and key services that need delivering for the island's population, and recognising we probably can't do everything. I don't believe there are any deep cuts that haven't been justified or that there aren't opportunities for doing things differently. We absolutely need to protect those frontline services, those urgent and emergency pathways, our cancer pathways. We want to be able to provide timely access to GPs and dentists. And a lot of work is going on to plan how we can use the money we have available to us for next year most effectively. Now, that inevitably will mean doing things differently and modernising some of our services. So, when I come back to the outpatient situation, we know that those services need modernising. Patients are often coming back for follow-up appointments unnecessarily. It's not clinically appropriate or warranted. And that is capacity we can use much more efficiently. And we want to introduce initiatives, one called Getting It Right First Time. We have to demonstrate efficiency and productivity. That challenge has been very clearly set to us, and we are absolutely focused on doing that. Now, that will require changes culturally to how we do things, and it will mean some changes in practice.
I mean, and I know we're fast running out of time here. You mentioned the doctor's pay offer last week. Timeline-wise, from the outside looking in at this, the timeline of all of this, this sort of embargoed media release goes out, it gets pulled. From our side, for example, completely my opinion, you would have thought that if those cuts were announced then, it would have made a point to the public of, we've not got the money to pay the doctors because look at these cuts we're having to make. That gets paused, and then next thing, a couple of days later, a sort of pay deal is managed to be found. Now, from the public perception, well, there's all these cuts happening. So, the fear, I think, from the outside looking in is almost the scapegoating of doctors here. It's like, where does the money come from to be able to pay the doctors? But yet we're seeing frontline services cut. I mean, can you see the patient point of view from this?
Oh, I can definitely see how those two agendas, those two items, which are incredibly separate, have arrived at the same time, and those comparisons and conclusions can be drawn. What I can say categorically is the settlement with the British Medical Association has no way impacted these plans. These plans were in train before that agreement. These plans were part of a wider and longer term obligation on Manx Care to work within its finances. With regards to that settlement, I have gone on record many times to say that Manx Care had available to spend on doctors' pay 6% for 23-24 and 4% for 24-25, so 10% over those 2 years, which was not accepted by the British Medical Association. Manx Care has not been in a position to improve that offer under its own financial piece. So in order for that improved offer to be made, we then had to go to the Department of Health and Social Care to seek support for that additional funding in order to make that offer. And I want to make that absolutely clear, because I don't want those two agendas to appear aligned in any way. Manx Care is really pleased that we have been able to settle the dispute with doctors. It allows us to move on and start doing all the other things that we really want to do, and those things that we've talked about, effective job planning and service planning and modernising our services. We both want that, doctors and Manx Care. I recognise the doctor's argument. There had been pay erosion. And Manx Care had understood that and wanted to mitigate that. In the 13 years, which the BMA quote of pay erosion from 2008, in that 13 years, there'd been an uplift of about 16%. Many years during that time, the doctors had 0% uplift or just 1% uplift. In the 3 years since Manx Care started, we'd put 19% on the table in those 3 years. And the offer that we have been able to put to doctors, which I'm grateful and thankful it has now been accepted, achieves that parity and starts to address the pay erosion. It's not for me to make judgment on whether that was right or wrong. As the accountable officer for Manx Care, I offered the doctors as much as I could within the financial envelope I had, and I'm grateful that I was able to get support from government to be able to improve that offer and ultimately result in that dispute being settled.
You said at the top of this interview that you've had a sort of, change in policy this morning from Treasury regarding the financial position in terms of allowing you to spend. We're talking about tertiary contracts and things on island as well. What does that look like from Treasury, and why do you think the sudden turnaround? Did they give you any reasoning for it?
No, I'm just grateful as ever that we are able to reinstate some of that work for our patients. This isn't about trying to hold a gun to anyone's head. Manx Care wants to deliver as much as it possibly can for our patients. But we also have to take our financial responsibilities seriously. And so, I don't know what has resulted in that change. I know there has been substantial levels of discussion on this matter, but I'm pleased and I welcome the approval to spend that additional money in order to reinstate some of those services.
And a final question for you. We've been taking a look at Manx Care's mission statement this morning. You've said your mission statement is to become the best small island health and social care system in the world. Do you think that's happening? And do you think the public would agree?
I think it's happening. I'm very proud of a lot of the services that Manx Care provide. And I think we, through the CQC and Ofsted, we are evidencing that level of improvement and that quality of provision. What I have to caveat that by saying is our services need an awful lot of modernisation. That is still required. Even years after the original report by Sir Jonathan Michaels, it is really important that we continue to modernise our services. But am I content that we have made really good progress in the last 4 years? Absolutely, I am.
And the $1 million question, have you considered your position?
As a chief exec, I think you always reflect on whether you are doing the right job to the right standard. Ultimately, that is a decision for my board. I know my board backs me fully. I am being asked to deliver comprehensive health and care services for the island's population within a very, very restrained budget, and a budget which does not match the original commitments of Sir Jonathan Michaels in an environment which has been subject now to comprehensive regulation and inspection for the first time. And in an environment of increasing healthcare costs and increasing healthcare demand post-COVID. There is not a health system anywhere in Europe that isn't overspending. And we know that some health systems are incredibly challenged. We have made significant progress in the last 4 years. I can evidence that progress. But our services still require a huge amount of modernisation, and there is still a huge amount of cultural reform needed within the organisation, particularly amongst our clinical staff. So it is really, really important when I come back to the settlement with the doctors that we move on from that pay element and start discussing how things need to look to become more efficient, more high quality, and essentially make our services fully fit for purpose. But, I cannot underestimate how difficult that is within the financial constraints. So there are some big decisions outside of Manx Care as to what is the priority for the island, what is affordable, and what are the priorities? What do people want to see? And then I will do the work to say this is what that costs. But ultimately, I think Chief Minister was very wise
to identify that there was a huge misalignment between the mandate given to Manx Care and what it was being asked to do for the budget. So I think that has placed Manx Care, the board, in quite a difficult position for an awful long time, as we have had to balance delivering high quality healthcare to the right standard, modernising the services, whilst also trying to do that within a very financially challenged budget.
Perfect.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.